Dr. Andrew Young at USC Orthopaedics, and today we're going to review the management of a complicated issue, specifically radiation-induced acetabular bone loss leading to a lytic acetabular lesion. And we'll show how this problem is treated with a hybrid total hip replacement. And we'll focus on the indications for cemented rather than cementless acetabular fixation. In this specific example, we have a 73-year-old woman with a history of metastatic cancer that had gone to the right hip. Over time, she developed severe degenerative changes in the joint, but the radiation that she had to this metastatic area also weakened the bone and then produced a large lytic lesion. The coronal CT allows us to see the extent of damage from the radiation. We see the lesion in the superior dome of the acetabulum here, associated with a stress fracture. The femoral head also shows severe degenerative changes and cystic degeneration. And in most cases, treatment is hip replacement. However, all radiation to this area has altered the biology of the bone, including the viability of the osteocytes here, which raises concerns about the reliability of bone ingrowth into a cementless cup. And this will therefore change our approach to fixation on the acetabular side. In the operating room, we began with a calibrated radiograph to control for magnification, and we place the patient in a neutral position. We have a neutral pelvis, we have symmetry between the obturator foramen, and we have the legs in the same abduction and the same rotation. This allows us to accurately measure both sides for eventual symmetry. Then plan for implant positioning. Here we place our acetabular component in the center of the acetabulum, and we choose a stem with the appropriate fit and fill straight down the canal that restores our center of rotation. Following exposure, the acetabular preparation follows standard reaming. We'll open up the acetabulum until we reach bleeding bone. The bed is then irrigated and all debris is removed. We then introduce cement into the area and then pressurize into this our polyethylene component. This is then held in the desired position of abduction and inversion until the cement hardens, which typically takes 15 to 20 minutes. This is a visual example of what this illustration looks like. Here's the surrounding soft tissue. This is the acetabulum. There's cement. This is the polyethylene liner. And this liner is being held in place in the appropriate position along the periphery of the acetabulum until this cement hardens. In this image, we will then take radiographs to confirm that we have restored the proper acetabular position, the center of rotation, hip length, and offset. So in this, we already have our acetabulum, our polyethylene liner in place. We can see the rim of cement interdigitating into the cancellous bone of the acetabulum. We have then placed our trial component and we reduced the two together. We have a level pelvis, and now we're measuring symmetry of hip length and offset. And on this side, we have 34 millimeters of hip length, and we restore that also to this side, 34 millimeters. This is our postoperative image. We see now the cyst has been filled. We see a polyethylene liner with cement interdigitation holding in place. We see our femoral stem. We see the ball centered nicely in our polyethylene liner with restoration of hip length and balance equivalent to the other side. This patient then elected to undergo, after healing, the management of the arthritic left hip. Unfortunately, this side had not undergone any radiation. Represents the conclusion. So the patient had presented with arthritis in both sides. This side had the radiation with the lytic bone mass. This side was fixed with the hybrid hip with the cemented polyethylene liner and a cementless stem. This side had not been exposed to radiation. It had a healthy, bleeding, viable bone and was able to proceed with the cementless hip for bone ingrowth, as well as the same stem and ball used on the opposite side. So this is how we achieve symmetry. This is a very useful technique whenever we're dealing with compromised, irradiated, or weakened bone. Thank you very much.